Hello, I am Dr. Akanxa Bhatti, and in this video I am going to discuss the hair transplant protocols for grades 4 and 5 male pattern baldness. So if you have a receding hairline and a see-through crown region at the back of your head, then this video would help you in having a better perspective of what to expect out of a hair transplant. Let me give you a brief overview of what grades 4 and 5 androgenetic alopecia according to the Norwood scale are. In grade 4 male pattern baldness, the frontal as well as the deep temporal recessions on each side of the head are more evident than those seen in grade 3 male pattern baldness. In addition, the crown region at the back of the head is only sparsely covered with hair. These areas of extensive hair loss in the front as well as the back of the head are clearly separated by a bridge of dense hair which joins the thick fringe on each side of the head. Depending on the patient's age and whether his baldness has stabilized or not, these patients can be broadly classified into two categories. In a young patient, say 21 years of age, with aggressive progressive baldness, we offer 2,500 good quality grafts which are in the anagen phase of the hair cycle. But these patients need to be coaxed into taking a long-term DHT blocker. After exercising this conservative approach, we need to wait and watch to see how his progressive baldness evolves. However, in a 35-year-old patient whose baldness has stabilized, we can increase the density of the grafts in grade 4 baldness. In such a patient, around 3,500 grafts can be used since we would be confident that his baldness would not be aggressive in the future. In grade 5 male pattern baldness, the three zones of hair loss, which are the two temporal recessions on each side of the head and the crown region at the back of the head, have almost fused. But the separation between the frontal and the crown regions of hair loss still exists. This time, this bridge consists of only thin fine hair. The frontal forelock now appears to be just a small island lying above the forehead. In these patients, I would prioritize the hairline and optimize the crown. If all variables are positive and on your side, one still needs to prioritize the hairline, the mid-scalp and the temple points on each side of the head. In other words, the bulk of the grafts need to be utilized to fill in the frontal region first. The crown region at the back of the head needs to be filled with slightly deficient density so as not to set the bar very high in case there is any progression of baldness in the future. Because if we do so, then we would not be able to achieve a high density at the sides of the crown region that we were able to achieve at the center of the crown region. And this would lead to something known as the halo effect or the island effect. This would be very unappealing, of course. The house of cards that we so painstakingly built would come tumbling down due to the progressive shortage of grafts. If you have any questions, please leave a comment in the comment section below. I would answer it the very same day. Thank you.